Okay, good morning, everyone. My name is Dr. Romina Ghassemi, and today we're going to go over about what every parent should know. So let's get this started. Thank you for joining us and thank you for being here. We're planning to have a webinar every week about different topics. So throughout the webinar, if you hear or a phrase or something that hits home, please don't hesitate to reach us because we want to make sure that we help people as much as possible by answering your questions. I would like to offer my knowledge, my experience, my expertise to make your life better. There's no cost to this other than come over, learn, and pass on and share the knowledge. So let's talk about Gen Z, our future. The problem is today's 20-year-old is the new 60. Now, why do we say that? How many of you are currently slouching as you're watching this? I know I caught some of you. Gen Zs are people that are born in the ages of 1997 to 2012, which we're talking about the 12-year-old to the 23-year-old. They tend to populate about 30% of the world's population. If a millennial is using 3 screens at the same time, Gen Zs use 5 screens at the same time. So that means like a smartphone, a TV, a laptop, a desktop, and also an iPad or iPod. Now they also spend about 70% of them spend 2 hours a day on their YouTube. They are 40% of the consumers of the world, and they are the do-gooders, which means that they always want to be part of some form of it, making an impact in this society. So they are our future leaders, doctors, engineers, senators, congressmen, and presidents. And therefore, it's very important that we take care of this generation. Why is this so important? Not just as a parent, but also as a clinician, is because how many times do you see this image? Well, before COVID-19. But does this look familiar to you? Do you find yourself in these positions when you're standing in line to get into the grocery store or pick up your coffee? According to a study, an average 18-year-old spends 7.5 hours of their time on smart device. Now, 7.5 hours is a very healthy sleep time. That is when our body is recharging. But if you're walking around or if you're spending 7.5 hours of your time, whether you're on your desktop, laptop, or cell phone, hunched over, how much fatigue and overload and stress is on your neck, upper back, shoulder, and compressing your chest cavity and overloading your lower back. These cause fatigue of the muscles, and this fatiguing of the muscles causes a lot of damages or prone to damages. Poor posture and bad breath are the first symptoms that are always noticed by other people first. And the common denominator between both of them is that they're stating there's a sign and a symptom that there's an underlying problem, underlying poor hygiene, an underlying health issue that's going on with your body. Bad breath is much faster noticed, but poor posture, we see this so often that it's almost like, oh, yes, typical things that I hear from my patients and from the parents. Yes, my kid slouches. This is not an acceptable fact. It's almost saying that, oh, yes, my kid has bad breath. What are we going to do about it as clinicians, as parents, as personal health coaches, or just being responsible for your own health and wellness? So let's work on seeing what are the effects of this poor posture on the body. There's a growing problem of Gen Z and also the following generation. We are a technology generation that starts with little games on smart devices, become adolescents that are just not in the mood of doing things because your body is so fatigued. Have you ever heard of a term called psychosomatic or somatopsychic? Psych means the mental power, and soma means muscle. It's the effect of the physical body on the mental health and the effect of mental health on the physical body. So let me give you an example. If somebody is depressed, what is their posture? And if somebody is happy and just heard a wonderful news or something amazingly happened to them, how is their posture? The effect of your physical body on your mental health has a direct correlation. As Gen Z is going through physical, poor body presentation, we are seeing more and more mental health issues in our new generation, in our Gen Z pop generation, which this is an extensive topic. I would love to talk about it more in the future webinars. If you're interested, please make a comment or reach me, and I'm going to answer all the questions at the end of this presentation. So we'll have that on a different topic with our guest speakers. Now, let's talk about back into physical body. Texting. This repetitive stress injury to the neck, upper back, shoulders can affect and can create what is known as trigger points. Trigger points create and cause tender spots in the middle of the muscle belly that cause headaches. So when you're texting and when your head is more forward, or you have what is called forward head syndrome, it compresses the sternocleidomastoid muscles, also known as the SCM. They pull the neck forward, changing the balance between the frontal muscles of the body, which are flexors, than the extensor muscles, which are your neck, your back muscles, creating a line of typical headache patterns. If you catch yourself with this type of headache patterns, know that it's coming from your neck and your upper back and repetitive injuries caused by constant forward head position. Now, why is this so stressful on the body? Let me tell you why. Normal posture is when your earlobe is aligned with the middle of your shoulder and your head sits comfortably on top of your body. That's a 0 degrees. Typically, your head weighs about 8 to 15 pounds. For every 1 inch that your earlobe moves in front of your torso, or that forward head position, there's an extra 10 to 15 pounds of pressure on your upper back. So now that 15 degrees of head tilt, people who drive, you typically have your head more forward. This puts an additional 27 pounds of pressure on your upper back. As your head is more tilted, all the way to the 60-degree movement, there's 60 pounds of pressure on your upper back and neck. Sadly enough, there's 3 times more on your lower back. So you're exuding and you're imposing 360 pounds of pressure on your lower back. So for those of you who are working from home and who get back pain because of sitting, please note that prolonged forward head position and poor ergonomics is not just affecting your neck and your shoulders, it's overloading your disc problem. So don't be surprised if you move suddenly, just like you always do, but today you moved in a way that you can't move anymore, or you're in dire pain because of a low back pain. This was not just because of your lower back, this was caused by your neck, upper back, and forward head position. So this progression of physical health problem can affect other areas of your body. Looking at a body from front, if you watch yourself that you have one shoulder higher, typically the body will compensate by balancing the pelvic going to the other direction. Your knees would roll in, your arches would fall, and this has a direct effect to every single joint and structure of your body. The muscles react to that structural change. So don't be surprised that poor head position or slouching or forward head body position or a protruded belly is going to affect your body, just not that area, but also affects other structures. Now, let me show you what happens. Look at a normal spine in a normal child. Right next to it is called scoliosis. When you go through structural changes, this will affect the body to twist. So children with poor posture will develop headaches, neck pains, scoliosis. They also develop asthma and short breath. They also develop TMJ problems. They also might have abnormal wear and tear on their teeth noticed by their dentist. They also can have balance and coordination issues. So if you have a child or if you yourself are athletically inclined, but you find yourself making frivolous mistakes or have not mastered that balance and coordination, check your posture, check your body position. These are important factors that you should know. When you're checking yourself or your child, your earlobe, your eyes should be in the same horizon. The earlobes should line up together. Shoulders must be even. Your pelvic should be even. So if you're wearing a bathing suit, the curve in your right and the curve in the left side of your body should match. Your kneecaps should be aligned and the arches should not be fallen. If you're looking just from the front. From side, the line that I told you about where your earlobe has to be lined up with the middle of your shoulder also has to run through the side of your hip, the side of your knees, and all the way directly to the outside ankle. This is a normal posture. And I will answer everybody's questions at the end. Now, we talked about poor posture causing visceral problems like asthma, digestive issues, heart problem, chest problem. Your spine is like a tunnel. And imagine your nervous system being the cars that run through this tunnel, like the information superhighway. When you are slouched and when you have a poor posture, it compresses the delicate nerves that exit those areas of your body and can affect the organs they feed off to. So look at the person in the lower part who has digestive issues, sitting hunched over, head dived into the computer screen. This causes pressure under the lower back. Now come to the body and look at the visceral and the organs. If you follow the nerve pathways from the lower back, you notice that they go to your entire digestive tract, but they also go to your reproductive organs. So if you have a child that has severe menstrual cramps and has poor posture, don't be surprised that it could be coming from neurological interruptions in the spinal cord area. So please have your child check their posture first, and then if you do find indications that are alarming, that are noticeable to you, please make an appointment. Go see your chiropractor to get them checked, x-rayed to make sure we can identify if it's already a skeletal problem or if it's still just in the muscular area. The good thing about an x-ray, it will tell you the difference between if it's a skeletal versus muscular, and if it is a combination of both, how fast is it progressing? The sooner we find this out, the better it's going to be. Progression of physical problem will have mental health issues. If you find your child that says, you ask them, so what do you want to eat? I don't know. Where do you want to go? I don't care. What do you want to do? I don't know. Don't be surprised, because this is an immediate effect of your body, an effect on the mental health. Progressive and prolonged slouching, especially in girls, can cause lack of confidence, can cause muscle fatigue and an overall uninterest in activities of daily living, and it can even lead to anxiety. Why would I say anxiety? Because when the body is slouched, shoulders are rolled forward, it compresses your chest cavity, affecting the normal function of the neuromuscular skeletal system, visceral system, your organs, and also your entire overall well-being. And it causes lack of oxygenation to your muscles, which cause additional fatigue, lack of oxygenation to the brain, which causes mostly brain fog, uninterest, just not being with it, not being so interested. The brain needs oxygen to function, and the body needs oxygen to function as well. So we will take this up in another webinar because it is such an important factor, and there's so many indicators that you would identify before you reach out for a bottle of pill or a prescription. So much preventive care can be taken to help bring us back into wellness, vitality, and healthiness. The first sign of any degenerative joint disease, also known as arthritis, or degenerative disc disease, or neurological condition, starts with poor posture. Poor posture is an expression of your body, of your spinal system and your skeletal system saying that I'm going through abnormal wear and tear. It causes scoliosis, degenerative arthritis, and that is osteoarthritis, which combine causes 90 over 90% up to 97% of most arthritises are osteoarthritis. Osteo means bone, arthro means joint, itis means inflammation. So osteoarthritis is the bones at the joint level are wearing and tearing and causing degeneration and causing inflammation. Degenerative disc disease means that the discs supporting in between the spinal vertebra are going through wear and tear. The worst part is the early damages are seen even in the younger ages. Currently in our clinic, we don't just see arthritis and degeneration in the elderly population. We are already seeing it in the 20s. And the most devastating thing was when I saw a 12-year-old with bone spurs in their neck. That is 12. So we have to be very cognizant about how we take care of our Gen Zs and how we take care of ourselves as parents. If you see your spouse, your loved one, or yourself having posture problem, please do not ignore that. Take the proactive measures so you can protect yourself. We started this webinar talking about 20 is the new 60 because we are very concerned as clinicians, as ergonomists, as risk managers. We are concerned about the new workforce coming into the workforce for the companies. Gen Zs may be underliving their parents based on everything that I talked about. Slouching and changing the pathway of the neurological and the nervous system will have an impact on our future generation. So please take the proactive measures, and now I'm going to talk about some solutions. So there is hope, and the best part about it is if you catch poor posture at an early age, you will have massive results in your overall health and wellness. So let's talk about the solution. If you're homeschooling your child, or if you're at work and you started working, please pay attention to your work environment. I know some of you, especially some of us, are working from home, and now we're homeschooling. So we go from your bed to the couch, to the coffee, to the kitchen counter. But let's pay attention to some basic factors. I'm going to call this ergonomic 101. Make sure that you're sitting either towards the edge of towards the 90-degree angle of the chair for your back to be supported. So the optimal reading distance from your eye to the screen should be an arm length away. So if you're sitting, just lift up your arm straight with your fingers straight. The distance between your fingertip and your shoulder is the distance between your screen and your visual field. Now, in this particular picture, this is a kid that's handwriting with you can tell it's like an older picture, but if we change the paper to a screen, the direction of the line of where the child's head is to number 1, that's where the screen should be. So prop it up so that way the child is working or you're working facing the screen monitor. If you have already been diagnosed with straight neck, move your monitor about 15 degrees higher so you promote a curve in your neck. Make sure that your back is straight. Keeping your earlobe lined up with your torso, your shoulder and your torso is the key. Whether you're sitting at a desk, whether you're going for a walk, or whether you're on the treadmill, make sure that your earlobe is lined up with your torso. A good supported back is going to help promote the curves in your neck, in your back, mid-back, we call it thoracic, lower back, lumbars. You want to make sure that your torso and your thighs and your knees make a 90-degree angle. So call that a 90-90 rule. And make sure that your feet are rested in a good position. Moving your feet up and down, having a little ball under your feet, or having it propping your feet so they're at an incline, help not to reduce any kind of cramping in your calves. So this is a good picture, and these webinars are available on our website as well. What else? Having a good mattress and a pillow is very important because you spend about 7 hours, 6 to 8 hours ideally, sleeping. So while you're sleeping, let your body work for you, not against you. If you're a side sleeper, put a pillow between your knees. Make sure you choose a right pillow that is not allowing your neck to go into hyperflexion or hyperextension, making sure that your head is not tilted, but apply the rule of 90-90, which means that keeping your earlobe lined up with your shoulder when you're sleeping on your side is also very important. So for those of you who are sleeping with two pillows, don't. That's all I can say, because you're going to wake up with stiff neck with the SCM problems. Make sure the lighting that you're using is good lighting and it's not affecting your visual field. Also, in between checking your monitor, please take your eyes off of the screen and look at a distance. You will cause fatigue to the muscles of the iris if you stare at the screen for too long. For ladies who are listening, and or any of you that are interested in some beauty tips, when you're using the computer for too long, you will get a little pouching underneath your eyes. Either your eyes will become hollow or they become inflamed underneath your eyes. So keeping your eyes away from the monitor, looking at your surrounding, and changing the direction of your distance of visual field is going to make a difference. And blinking is what helps reduce eye fatigue and dryness. Keeping a diffuser by your workstation is going to be very helpful in keeping your eyes moist. So that's very important for your vitality, your visual vitality. And also sitting, again, your posture is an expression of your nervous system health. Take care of it. It will take care of you. So if some of you are like me and sometimes forget and dive into your work, using a wearable posture support can help you immensely. I recommend BAX-U posture support for several reasons. One, it does not compress your armpit. If you buy a posture wearable that compresses your armpits, you're actually causing double damage. Why? Because there are a group of nerves and arteries that can start from your neck, feed off to your index finger and your thumb, feed off to your last three fingers. That area that runs under your armpit is called brachial plexus. If you compress that area, you will get nerve pinch and you will get numbness and tingling and weakness in your fingers, and it would defy the purpose. If your shoulders, the shoulder are not being adjusted because we have different body types, you will cause forward head position. So adjusting the shoulder position on your posture support is very important. Correcting the posture is very important. That means you have to correct the back as well as the rounded shoulders. That's the only way you can move the head and the neck back into a proper position. You do not want any pinching or chafing of your skin. You want to make sure that it's incognito and it's subtle and it's thin. BAX-U posture support is the only posture wearable that is not only researched by universities in the United States, Michigan University, it's also tested by corporate wellness, proving that using the wearable BAX-U posture support over 12 weeks improves posture by 90%. Now, if you want to have a better result, wear your posture support and perform exercises or be under care so you could have faster effect. I hope this was helpful. And we have some testimonials from, let's see if I can share this with you. How old are you?
10.
And what grade are you in? Fourth grade. And you wore the brace, right?
Yeah.
And how did it feel when you had your backpack on?
Well, it made me stand up straight. I didn't slouch like that because it was so heavy.
Can I see your backpack? Can you show it to me? Wow, that looks heavy.
Yeah, it is.
And when you have your brace on, how do you feel?
It's
Okay. Resume share. I was trying to see if I could I was trying to see if I could play these testimonials for you, but the YouTube channels are there. Look for BAX-U posture support for children and also for adults. Now, to summarize it, dare to be better, dare to be taller, dare to be smarter, and dare to be happier. Give yourself the gift of health. Make sure that your ergonomics are in the correct position. When you're walking, be cognizant of having your ear aligned with your shoulders. Perform yoga or regular back exercises. Support your neck and wrist when you're using your phone. Wear your BAX-U posture support. Wear your backpack high on your shoulders and sleep with the correct pillow and mattress. Make sure your lighting on your computer is properly positioned so you're not causing over glare. And please do not use smart devices in bed. And I know this is such a habit for a lot of people, but let me just tell you, give your brain the energy and the power it needs to recharge for the next day. So keeping your smart devices away from your bedtime an hour before is going to give you an extra source of energy and vitality on your next day. I hope this was helpful. My name is Dr. Romina. I am here to help and support and share my knowledge with everyone. So please don't hesitate to contact us and let us help you and create a webinar that's beneficial to you. I'm going to